Whenever we talk about the bladder cancer, I've already told you that the most common cause of bladder injury is the fracture pelvis, which is associated with the extraperitoneal, and it is iatrogenic, you can say, entities which are associated with the intraperitoneal surface. Cystogram is to be done. We have a we have a static phase, we have a voiding phase, and we need to concentrate on the intraperitoneal or the peritoneal surface of the bladder, as well as the extraperitoneal, which is in the space of Retzius. So this is what is very important. Whenever we talk about the concept of bladder trauma, students, before I go to the approach, let us discuss with you the grading of bladder trauma. 90% of you don't know about the system of bladder injury grading. So before I move forward, let us understand grading of the bladder injury. Grade 1 is nothing but a simple contusion, or you can say intramural hematoma. So intramural hematoma or contusion is grade 1, or students, or it could be laceration, but this time what kind of laceration? It is partial thickness. It is partial thickness laceration. This is what is very important. When we talk about the grade 2 of bladder trauma, it is less than 2 centimeter. This is what is very important. Less than 2 centimeter laceration, full thickness laceration, that is. So less than 2 centimeter laceration of the what surface? Of the extraperitoneal surface. So this is what is very important. So extraperitoneal laceration less than 2 centimeter. Then grade 3. What is grade 3? Remember, more than equal to 2 centimeter laceration of the extraperitoneal bladder. This is important. So extraperitoneal bladder more than equal to 2 centimeter, or less than 2 centimeter laceration of the intraperitoneal bladder. So all these things are very important. So we have extraperitoneal bladder, we have intraperitoneal bladder. What about grade 4? This is again very important. What about grade 4? It is the more than 2 centimeter laceration, more than equal to 2 centimeter laceration of the intraperitoneal bladder. So you can see there's a difference between the extraperitoneal injuries and its grading and the intraperitoneal. What about grade 4? Any laceration, this is what is important. So any laceration extending to the trigone, this is very important. So any laceration of the bladder extending to the trigone, this is what is known as grade 5. This is very important. Now students, let us understand and formulate a simple basic approach to the bladder, you can say, injury. So whenever you have any patient of suspected bladder trauma, what is the classical way of suspecting it? This is what is very important. There will be anuria. Along with that, there will be blood at the tip of the meatus. So anuria with blood at tip of the meatus, and along with that, one more thing is that collapsed bladder. Normally, if it is a urethral injury, you might find a distended palpable bladder in that case, but here there is a collapsed bladder, or I would not say collapse, I would say non-palpable bladder. This is what is very simple thing. However, these features are not always, you can say, present. So whenever you have a slightest of the suspicion, the patient has anuria and blood at meatus, and you suspect it to be a bladder injury, what is the next call? You will be going for cystogram. This is what is very important. So 250 cc urographin is what is pushed. So there will be retrograde push of the, you can say, of the 250 cc urographin. So now understand, this is what is the scenario. So you have all the urographin full inside the bladder, and then what is the next thing? You will click a static phase image. So static phase image will confirm, okay, the dye is there inside. So static phase image, and then you will go for what, students? Voiding phase, and this is what is very important. So when you ask the patient to void, what is the next thing that you want to check? You will check for the contrast leak, and this is what is very important. So if there is contrast leak, yes versus no. So if it is contrast leak, yes, it confirms what injury, students? Bladder injury. Wait, the game is not over, it will start from here. If the contrast leak is not there, if it is no, then remember, try to rule out what injury, students? A urethral injury. So this is what is very important. So why do you have anuria? Why are you having blood at the meatus? Either bladder or urethral injury. This is simple. Now let us not go into that urethral injury right now. We will be studying urethral injury after this, but let us understand the concept of bladder injury. So if you want to confirm the bladder injury, what is the next thing, students? You will look for the site of leakage, and this is what is very, very, very important. So if the site of leak is confined to the pelvis, so if it is confined to the pelvis only, then this is what, students? This is the extraperitoneal injury. This is what is very important. So this is an extraperitoneal injury. If it is confined, if it is, you can say, the site of leak is the abdominal cavity. So how do you check whether there is a leak in the abdominal cavity, students? It's very simple. You will have to see the fullness of the paracolic gutter, and this is what is very important. So fullness of the paracolic gutter, that means the urine or the contrast mixed urine has, or the contrast has gone up into the, you can say, abdominal cavity, and it has caused the paracolic gutter to be full. And this is what is suggestive of what? Intraperitoneal injuries. This is what is very important. So intraperitoneal injury. When we talk about what is their final approach, this is important. So the nutshell, what is the management? All intraperitoneal injuries require a surgical repair, whereas extraperitoneal injuries don't require. What is that? So when we talk about the management, you will have to do a Foley's catheterization. What is the aim of doing Foley's catheterization here? Students, it's a bladder which is distended, bladder is elastic. If you don't put a Foley's, the bladder will keep on contracting, relaxing, the healing will never happen. So when you collapse the bladder over the Foley's, the urine will be passed and spontaneously the hole or the primary injury will be repaired. So Foley's catheterization for 10 to 12 days, this is more than sufficient. But when we talk about the intraperitoneal injury, what is the problem? There is increased risk of chemical peritonitis, and do you know this chemical peritonitis will cause the bacterial peritonitis, and this bacterial peritonitis, you know the problem is. So remember, you will not wait for that thing to happen, and when your brain knows those things, you will always go for a what? Therefore, you go for urgent surgical repair. When we talk about surgical repair, what are the important things that we need to understand? I'll share on my, in this video lecture, I will share recently I did a bladder injury repair. So that urgent surgical repair. And what is the suture of choice? If you are doing a laparoscopic repair, 10. If you are doing a, you can say an open repair, you can use a 20. So 10 or 20 polygalactin, that is Vicryl. So polygalactin 910, this is what is, or Vicryl, and there is no added efficacy of single layer, or it is option or double layer repair. This is what is very, very, very important. So single layer or double repair, but you need to understand there is no added advantage. Most of us are now doing a single layer repair only. Let me share with you one classical image also. So I'll try to find that photo for you, and I want to share that. So this is a CT, image, and I will also share one image from my library section to show you this bladder injury. Just hold your patience for 1 minute, and so whenever I have to find an image, I always am puzzled where it is, but when I am searching for something other, I will find that image. So just hold your patience, and yeah, it's there. And it's again, I will add it and drop it in your notes. So the best part of Surgery Dada is that not only you get the video lectures, you also get the, you can say the PDF notes also after the class. Okay, so just see, this is a intraperitoneal injury. Why? In the peritoneal cavity there is a urine leak. So this is nothing but intraperitoneal. If you see here, this is again intraperitoneal, classical intraperitoneal injury. This is intraperitoneal injury. This is again very simple. Try to see this. This is a bulb, and you can see the contrast is confined to the what, student? To the pelvis. So this is extraperitoneal injury. So extraperitoneal injury. This is what is again very simple. This is intraperitoneal. Can you see the fullness of the what? Fullness of the paracolic gutter. So this was about everything about the concept of what? Bladder trauma, and it is also very important.